2015 recommendations. And key to enable that is having the dispatchers be able to effectively diagnose a cardiac arrest by focusing on the ascertainment of agonal respirations of the patient through the information provided by the caller. Again, in 2015, for the lay rescue or basic life support provider, is the emphasis on quality CPR. Clear evidence that shows that chest compressions need to be provided at an adequate rate and adequate depth, allowing full chest recoil and minimizing interruptions in chest compressions, and all the while avoiding excessive ventilations. I'll return back to this, but it's important for the lay rescuer and basic life support to push hard and to push fast when they're dealing with someone in cardiac arrest. There's also recognizing the evolving burden of risk and injury associated with opioid-associated life-threatening emergencies, having some kind of strategy in very precise situations and precise environments of bystander naloxone use in opioid-associated life-threatening emergencies. It's important for resuscitation stakeholders in Canada to understand that at present, bystander naloxone is still a prescription-only medication available within Canada. And we look forward to working with stakeholders in moving this initiative along across Canada.
I'm the only moderated comment up on the Heart and Stroke Foundation. They sent the authors a letter, Dr. Laurie Morrison and Sean Hopkins at the Works, about the training of chest compressions only for an opiate overdose, which is a respiratory emergency like the hundreds of other causes. Alias CPR, also known as @GaryCPR on Twitter. And this is the hyperlink, which you can hyperlink for days and days. That's pulmonary edema. Lack of ventilation will cause you to get pulmonary edema, which will kill you. Any respiratory emergency, you don't inflate the lungs enough. Yeah, the British Medical Journal, I'm also published in there. Yeah, anyway, there's a whole bunch of them. Oh, hyperlinks, hyperlinks, hyperlinks. You can check it all out. It's a no-brainer. I'm also published in Medscape. There are some case reports in children, women and children, and Naloxone ineffective. The only thing that kept them alive was ventilations until they started breathing on their own, because Naloxone doesn't always work. You gotta give them respiratory assist. Anyway, it's a breathing emergency. That's the end of Aaron Organ's PowerPoint. Anyway, response to this. Dr. Eric Hoskin standing beside a picture of chest compressions only. There's the bear. Told him to stop doing that. That's murder. There's Joe Mahevic. He's the chair of the Board of Health. Counselor Joe Mahevic. He's Toronto Drug Strategy. 900 doctors have written this guy a letter. Told him to stop teaching this chest compression stuff, because it's not a cardiac arrest. It's a respiratory emergency. Note here, Dr. Aaron Orkin, he's the 2015 AHA guidelines. Sean Hopkins, the manager of the works. But then we got down here, down the bottom, Dr. Laurie Morrison. She's the director of the Rescue Resuscitation Program, supposed to be an expert on resuscitation. So this is the Canadian Journal of Public Health, 2013, page 200. And this is page 201. The protocol that they teach. They've been teaching this to tens of thousands of people in Ontario, many health districts. Call 911, Naloxone, and then chest compressions on a nice cyanotic blue background, and more naloxone after 2 or 3 minutes and continue with chest compressions. This is the signs and symptoms they teach everyone. Can't wake the person up. Coma. Breathing's very slow, erratic, has stopped. Deep snoring or gurgling sounds. Chain stokes respiration. Fingernails, lips are blue or purple. That's cyanosis. And the body's very limp from being in a coma. And then the pupils are very small. That's meiosis. All these signs prove your heart's beating and you're dying. Lack of oxygen could be any of the hundreds of causes of respiratory emergency. This is Dr. Aaron Organ, part 10 of the 2015 guidelines on resuscitation. And see, the following parts were last updated in 2010. Part 12 on cardiac arrest in special circumstances. Yeah, that's toxins, because any poisoning is a respiratory emergency. And then we got, here's the 2010 guidelines. Dr. Lori Morrison. She was co-chair of the ILCOR and AHA 2010 guidelines on resuscitation in special circumstances. This is page 840 from the 2010 guidelines. The initial approach to critically poisoned patients begin with airway protection, support respirations, and circulation. See, that's circulation. If you're dead because your heart stopped, then you give them CPR. So this is what you're supposed to do. No, antidotes are not resuscitation medications, because if your heart's not beating, there's no blood pumping, so the antidote can't get to the brain to do its work. Follow basic life support, rescue breathing, and then if it's cardiac arrest, that's advanced cardiac life support methods. So naloxone binds to the receptors in the brain, and it can work. Not will. You know, it doesn't always work, because you can have, this is page 841. Naloxone has no role in the management of cardiac arrest, of course, nor any antidote, because there's no blood flowing because your heart's stopped. So ventilation should be assisted using a bag mask following administration of naloxone and placement of an advanced airway if there is no response to naloxone. Bag mask is rescue breathing for a layperson. Advanced airway is rescue breathing for a layperson. Some patients may require a much higher dose of naloxone because it doesn't always work. Anyway, because if you underventilate any person, they could get pulmonary edema, which will kill you. Heart and Stroke Foundation, 2013. They have a chair on the resuscitation guidelines. I sent them a copy of the training literature of public health. Anyway, and so they sent them this letter. The compressions only is for a sudden witness cardiac arrest for a lay responders never been trained. Toronto Public Health's training sessions last from half an hour to 19 minutes. Protocol administers respond to a sudden witness cardiac arrest because the blood's still oxygenated. Rescue breathing for any poisoning, any drug overdose. A person's alive, don't push on their chest. I'm the only comment up on the Heart and Stroke Foundation. Heart and Stroke Foundation manager sent Sean Hopkins, a manager that works at Toronto Public Health, and Lori Morrison, You see that Laurie Morrison wrote the guidelines, as all guidelines say, respiratory emergency, respiratory assist. Both those authors are in the Canadian Journal of Public Health, the first article I showed you. Then we got this. This is a letter from Dr. Laurie Morrison. Yeah, she helped craft the protocol for chest compressions only. She thinks it's the right way to go, and she's happy to discuss. She copied it to Alan Orkin. And Public Health, Aaron Orkin, and Public Health Toronto were more involved than I was. I was just the expert brought in to help out. So I phoned her up, says, okay, I'll meet you, I'll bring a tape recorder. She phoned the police. I get a call, can you come to the station? Sure, I'll be right there. Get in there, the cop says. Gary, I want to shake your hand, you're saving people's lives. Bad news is, Dr. Morrison doesn't want to talk to you anymore. Well, I've talked to her since then. The lady needs help. Public Health changed the protocol in 2015 to 2016. Changed it across the province to Naloxone and then full CPR and or rescue breathing as trained. Well, they're training these people one-on-one in small groups. And is it working? Stick around with repeat steps 3 or 4. So what the heck? Big print. And then it's small print. Then, this is 2017. They changed it up totally. This is coming down from the Ministry of Health. They sent this to all the pharmacists in the province. There's no mention of CPR or rescue breathing anymore. There's over 900 doctors wrote a letter to Mr. Hoskins over the last few years going, what's going on? Anyway, because Public Health now has safer injection sites and the nurses are given nothing but rescue breathing because the patient could wake up on their own without naloxone. Yes, sir. So they've been caught in their own bloody lie, and they've been murdering people. And Hoskins is still teaching chest compressions only. The man needs help. He's costing you hundreds of millions of dollars needlessly. This is the Ministry of Health's website. Anyway, he's crazy. Oh, no, crazy. Sent this to Dr. George Dawood. He's a Windsor family pharmacist. And this is people I used to work at South Riverdale Community Health Center. Yes, sir. And this is what's in the kit. No rescue breathing barrier mask. There's Mr. Hoskins' insert right in there. And this is how to recognize an overdose. All of those signs prove your heart's beating could be any of the hundreds of causes of a respiratory emergency. You never push on a chest. Their heart's beating because they need air. And then it's got chest compressions. No depth. So people are pushing right to the dang floorboards with you. And crazy, man. It's costing you hundreds of millions. And any 5-year-old child knows. Any of the hundreds of causes of breathing emergency, give them air, air, air. Nothing wrong with the heart.
Prepared. They all have naloxone. The most important thing when they get on site is actually ventilation as well as naloxone. But I think what we heard loud and
well, we were told today that, for example, because that precise example was used as to whether other first responders should have naloxone, and it was said that that was not the case, that the priority, for example, when the fire department are often the first to arrive, should be on ventilation, as Dr. Yaffer just said. But let me just say this about the
all right, it's important to be able to recognize when somebody's overdosing on opiates. Of course, when somebody does an opiate, they start to nod. They start to nod off. They start to look as though they're falling asleep. That's normal. And then they go beyond that. When you get into overdose, you're going beyond that. The breathing starts to slow down. The person is hard to wake up. If you are looking at for physical symptoms, the lack of oxygen from the breathing slowing down starts to cause their lips to turn blue. Their skin feels sort of clammy. They're very hard, they're very limp. And even if they may be even if you think they're breathing, they may be making sort of a gurgling or a snoring sound that sounds kind of like not necessarily breathing. Just a sort of a sign that the back of the throat is really too relaxed to be able to breathe effectively. So, and when you try to wake them up, that's when you're starting to respond. But that's one of the first things that you do if you're responding to the overdose. All right, so let's go through what's in.
No barrier mask in the kit, and if you can't understand that that's a breathing problem, something's wrong. This is the 2017 instructions from the Ministry of Health. From the video, it was different. Then in 2015, they changed it to this. They put in chest compressions, that's what was in before, but they added CPR and or rescue breathing in 2015. It's supposed to be rescue breathing here. That's blue cyanotic color of skin, dying lack of oxygen. If you can't understand it, they taught tens of thousands of people to do that, and they've been publishing it in the newspaper. Those are the signs of any respiratory emergency, which there's hundreds of causes. They need air, their heart's beating. If you're breathing, your heart's beating.